what we're talking about here is called anesthesia awareness. It's a very important question, one that's actually asked very often by our patients. And I can say this, even though it's extremely rare, being awake during surgery is still one of the most common concerns that our patients do have. So I think that movies and TV, they have definitely dramatized this big experience of patients being awake during surgery. And it's good for their ratings, but it definitely sends sort of a misinformed message to our patients. So I'm happy to answer this question. So when my patients ask me, will they be awake during surgery, or will they remember it, or will they feel it? I basically have two variables that I account for before I answer their question. First, I reassure them, but in the back of my mind, I have who is my patient in front of me and what is the surgery that we're dealing with. So let me explain. There's certain surgeries actually that intentionally call for a patient to be awake throughout the entire course of the procedure. So take, for instance, a C-section, right? So a baby is born through a surgical experience, so through an incision at the belly. And here what we're able to do is anesthetize the lower half of the mom's body and keep the upper half awake so that the mom can be a part of their first minutes of their child's birth. So it's very cool stuff. And so here we intentionally keep our patients awake so that they do have awareness and they do have recollection of that event. So that's sort of the beginning spectrum. And then there's some surgeries that just require some local numbing with some light sedation. And so think of your dentist office, for instance, and you may remember a lot of events, but it still may be a little fuzzy. But most of the time that patients ask these questions, they're undergoing more involved surgery, right? And so they have a high priority that they don't want any recollection of the surgical experience. So I can tell you as an anesthesiologist, I share that priority with my patients. So what we do is we give you a preoperative amnestic medication. And an amnestic medication is one that helps prevent sort of short-term memory formation. So there are drugs like Valium or Versed. These kind of drugs help patients decrease their anxiety level, kind of relax, help them forget about the surrounding events that are taking place around them. And again, so in more involved surgeries, we're likely giving general anesthesia. We follow up the amnestic drug with what we call an induction drug. And so induction drugs are like the popular propofol that you may have heard of, and that drug then brings you into an unconscious state. So then it's our job as anesthesiologists to keep you in an unconscious state, keep you asleep during the remainder of your surgery. And we kind of do this by delivering certain drugs or gases to keep you asleep the whole rest of the way. And so that's sort of our goals in a nutshell. So the goal of general anesthesia is to achieve amnesia, which we give you preoperatively, analgesia, which is essentially pain control, both during and after surgery, and what we call anesthesia, and that's keeping you asleep during the entire course of the entire surgery. What we do is anesthesiologists, we're information gatherers. So during the course of your surgery, you'll have a continuous monitoring that goes on, your blood pressure, your heart rate, your respiratory rate, other monitors. And we take all that information in to diagnose whether or not your anesthetic needs to be adjusted in any form. And we respond. And so, you know, anesthesia awareness, it has been reported, but I can reassure you that the incidence is very rare. In fact, over the last 40 years, the incidence has decreased 10 times. So we've made considerable advancements in this space as anesthesiologists. But again, I can understand how the thought of experiencing awareness under anesthesia can be pretty nerve-wracking, to say the least. It's important to know that in the rare occurrence of awareness under anesthesia, it's important to know that patients typically don't feel any pain at all. So don't let this keep you awake at night before surgery. Try not to worry. One thing I wanted to say was that it's very common to kind of remember the surrounding events around your surgery. So patients sometimes can remember rolling into the operating room, maybe having monitors placed or an oxygen mask placed before you're given the medicine that drifts you off to sleep, or when the infusions or the gases wear off at the end of surgery. You may remember some events after the surgery is over as well. So these memories surrounding your surgery are somewhat to kind of be expected, and they can be kind of considered part of the normal experience, the normal process. And some patients actually, it's interesting, they have very vivid dreams during surgery, and they may have thought they experienced awareness, but really they were just dreaming during surgery, and it's very common for that to happen as well. There are certain circumstances that would increase a patient's risk of having awareness under anesthesia, right? So first of all, I want to say who delivers your anesthesia really matters. So a physician anesthesiologist has tens of thousands of hours of expertise and experience in this space, in his trade, in his craft. And so the safe titration and the delicate dosing of anesthesia requires a high level of skill set. So make sure at the very least your anesthesia is being delivered by a skilled physician who preferably is board certified. At the very least managed by a skilled physician. So before surgery, anesthesiologists are a detective of sorts, and we help sort of get a better understanding of your overall health, which medicines you take, which drugs you might take, which herbs you might take, what allergies you may have, what issues you've had with anesthesia or surgery or in the past. And this is basically all the information that we gather to help us determine who you are as a patient and who we're dealing with to make sure they're safe and sound during surgery. So it's my patient's health status combined with which surgery you're having that ultimately determines what your overall risk of awareness may be during surgery. So certain patients actually have an increased risk of awareness, and most of those patients have also a poor state of health. Okay, so those patients who have a lot of sicknesses or have a lot of multiple medications or multiple conditions or medical conditions, they may not be able to tolerate the same amount of anesthesia as a healthy or a fit individual. And in those circumstances, the incidence of awareness may increase. So we have to sort of weigh a patient's overall risk with their risk of awareness. And we'll always make sure that our patients are safe before anything else. And again, the type of surgery matters too. So trauma surgery, open heart surgery, emergency surgeries, they've also been connected to an increased risk of awareness. Because those surgeries are really high risk and actually deal with a lot of sick patients as well. So they have an increased risk of awareness as well. So once again, our first job is to maintain your safety, and we will do that at all costs, even in the rare circumstances of emergency surgery where awareness may occur. If you do feel like that, please don't hesitate to contact your physician, address your concerns, let them know what situation, and your doctor will definitely lead you to help and to make sure that you're well taken care of. Maybe get counseling or be able to talk through all of these things. As a community of physicians, anesthesiologists, we have a big pride in making sure that this is one area of our trade that remains safe and sound, to decrease and eliminate awareness during anesthesia. So there you have it. That's your long-winded answer to a short question, but I hope this information helps, and I'll see you next time.